Monitoring biological risk is extremely complicated if we take into consideration the environment we work in, the oral cavity, and the complex medical devices we use. In their daily work, the dentist in charge of the surgery, hygienist, and assistant must follow procedures and protocols conceived to safeguard the health of all patients and the personnel. For both patients and operators, the surgical instruments used for the treatments represent a particularly high risk of disease transmission. The following protocol provides information on the correct approach to the disinfection and sterilization of instruments in the dental practice.
Disinfection and sterilization involve many phases we are now going to look at in detail. Potential exposure of operators to biological agents begins with a collection of materials used during a treatment. When doing this, the operator must wear specific personal protective equipment. To avoid marks and corrosion, contaminated instruments must be separated according to the materials they are made of. Jointed or hinged instruments must be opened before placing in the container. You should use specific, rigid, closable containers with handles at the side and a removable grill to reduce the possibility of accidental injury and leaks of fluids. Before washing, the instruments must be disinfected by immersing them in a broad-spectrum liquid disinfectant active in the presence of organic residues. The disinfectant solution must be prepared following the manufacturer's instructions scrupulously, respecting the dilution percentages and immersion times indicated to make sure disinfection is effective and avoid damaging or corroding the instruments. The instruments must be fully immersed in the disinfection bath. Avoid placing aluminum or titanium instruments in the ultrasonic bath, as it could damage the material and color of the instrument. The disinfected material must be rinsed thoroughly before washing. The aim of washing is to remove organic and inorganic residues and microorganisms. This can be done either manually or automatically in an instrument washer or thermal disinfector. Manual cleaning involves cleaning the disassembled instruments using a non-metallic brush while they are immersed in a cleaning and disinfectant solution. Remember to wear specific gloves while you do this. After the disinfection and washing, the instruments must be rinsed thoroughly before drying. Moisture could compromise the outcome of sterilization and lead to the formation of marks on the surface of the instrument. Dry the instruments manually, preferably with a disposable cloth which does not leave fibers, or with compressed air. Instrument maintenance ensures their durability and guarantees a high-quality service. Apply specific lubricants soluble in cold water. If the material is steam sterilized, the products must be silicone-free. Sort the instruments into pouches. For each pouch, indicate the sterilization and expiry date and the operator performing and verifying the process. All pouches must also have a chemical process indicator and sterilization integrator. The pouches must be placed in the trays next to each other with the paper side facing up and with no overlap. The trays must be placed in the autoclave, non-overlapping or masked. To sterilize surgical instruments, we suggest using a Class B fraction vacuum wet heat autoclave. We recommend sterilizing instruments at 134 degrees at 2.1 bars or 121 degrees at 1.1 bars. Wait for the drying cycle to be completed, as any water left in the pouch could over time lead to corrosion and oxidation of the instruments and generate bacterial formations. At the end of the process, the pouches containing the sterile instruments must be kept in a dry, dust-free atmosphere, away from the light and sources of heat.
Disinfecting and sterilizing your instruments correctly will guarantee safety for your surgery and your patients.